region's business, improving our economy, creating jobs, and strengthening communities. Innovation, collaboration, transformation, and the people making it happen. Join us as we take a closer look at our region's business. Now, here's your host, Bill Flanagan.
Today on Our Region's Business, unlocking our region's full potential for innovation. We'll find out how robotics is remaking manufacturing and the potential to grow an industry here in autonomous vehicles. But first, the multi-billion-dollar investment that's underway here in healthcare and life sciences. Just this week, UPMC and the University of Pittsburgh announced plans to develop an historic building near Shadyside Hospital that will house, among other things, an immune transplant and therapy center focused on new ways to fight disease.
UPMC's announcement that they're willing to invest $200 million over the next 3 years on this targeted applied research effort to translate science into new therapies is really groundbreaking. That will create a very fertile ground for commercial activity. And the second part of the story is creating an environment where that activity wants to happen right here in Pittsburgh. So it's about place. It's about a place where companies can rub shoulders with the academic researchers, where other companies can start up and grow right here in this Shadyside Bloomfield neighborhood. So we're very excited.
The new center will be housed in an historic building at the corner of Baum and Morewood in Pittsburgh's East End that used to be an assembly plant for Ford Model T cars. And it's just one example of the investment that's underway in our region in response to a finding from Brookings last year that the innovation happening in Pittsburgh is not resulting in the level of economic growth that it should be. The University of Pittsburgh is setting out to address that challenge by developing a new life sciences accelerator in Pittsburgh's Strip District. It's to be called LifeX, and the goal is to get more innovation to market. Rebecca Bagley is Vice Chancellor for Economic Partnerships at the University of Pittsburgh, and Dietrich Steffen is founder and CEO of LifeX. Good to have you both here. And Rebecca, welcome back.
Thank you very much.
Well,
my pleasure.
Yeah, we already heard from your boss, the Chancellor, so I'm going to start, with Dietrich. So what's LifeX all about? What's the idea about it?
So the goal is to really take advantage of Pittsburgh's innovation ecosystem in the life sciences. We are fifth in NIH funding nationally, National Institutes of Health funding, pouring hundreds of millions of dollars into research, but historically a lot of that research has died on the vine before making its way out to positively impact those who are suffering and dying.
But why is that? You've got all these great things, all this great stuff happening. Why doesn't it get out of the university?
Well, that's what LifeX is for. It's a platform, it's really an ecosystem, and it's a comprehensive solution for driving this research into the form of new companies or into the hands of large corporations that can then ultimately bring it to market.
Okay.
It doesn't magically happen when a scientist publishes a paper.
Oh, darn. Yeah, which I mentioned is a rude awakening to scientists with great ideas and great discoveries. Yeah. This is, seems to be a really important initiative to the University of Pittsburgh.
Yeah, it absolutely is. I mean, you know, we're excited on a lot of different levels. One, it really helps us drive that translational benefit into society. And I think, you know, with Dietrich's past experience as an entrepreneur and also as a scientist, we thought it was really important that he lead this platform to be able to really look at what are the global health challenges out there, and then how do you map our technology to be able to create companies around that. And so that market facing is a real differentiator.
So there's different pieces to this then. What you will be taking a look at what's happening across the university and really trying to figure out what those ideas with potential really are?
Absolutely. I mean, it starts with unmet health needs, highly prevalent diseases that are intractable, can't do anything about it, and that are really horrific in their nature. That's where we start. And then we try and understand what the best solution would be to address them. And then we dip into our technology base at the university and here regionally and source those, package them up, and build products, and then deliver those into the hands of doctors so patients can benefit.
Yeah, Chris, there's a lot to building a business, more than just a great idea and a great scientist. It takes management talent and it takes money. Is that part of this equation?
Absolutely. So when we at the university cured polio decades ago, there was nothing. We had to sort of osmotically let it happen. Today we're talking about a facility, 20 to 40,000 square feet in its first incarnation and then scaling, where we can house companies that are building these products. We've already got about 20 companies that are frothing to get into this facility, developing solutions to Alzheimer's disease, cancer, juvenile diabetes, obesity, type 2 diabetes, all of the large problems that we face as individuals and in our families. And it's mentorship. People that know how to build companies will be in this facility helping them, and ultimately investment capital as well. So we're raising 2 equity investment vehicles to capitalize those companies so they have enough juice to build what they need to do.
It really rounds out and builds the region's capacity then to unlock more of this innovation, right?
Yeah, I think as you mentioned in the lead-in, the Brookings report really showed that we have an incredible capacity to be a global innovation city. But when you looked at the life sciences, you had these assets that Dietrich talked about around the research, but that wasn't being translated. And that came out both in that and in the life sciences opportunity analysis. So this is one of the major highly curated vehicles that links us to the actual market.
Yeah, and you say already a couple of dozen companies or 20 or so companies that want a part of this. Are you finding the same interest on the investment side? Do you think the money's out there to invest in these types of companies?
There's no doubt about it. So we've been quietly building these companies for the last almost 5 years here in Pittsburgh, based on Pittsburgh innovation largely. And we've got tier 1 venture capitalists from Boston and San Francisco that are putting money into these companies. And I'll just mention a few household names. Sequoia Capital, Peter Thiel, the first investor in Facebook, and the co-founder of PayPal, is an investor in our antibiotics company. Vinod Khosla, the former CEO and co-founder of Sun Microsystems, Khosla Ventures, is in one of our companies. Pfizer is a partner on our cancer drug company. So you're getting a sense with this unveiling that we can do it here. It's not abstract that we're standing this up and hope to do it. We've been doing it, and we're unveiling this as the Pittsburgh can-do story.
That's great. How fast do you think this might unfold, especially the physical presence?
So we've already launched in many ways. The physical presence will manifest by the end of the first quarter, so coming up very, very quickly.
Okay.
And then we actually have a Life Science Week that we've been hosting in April. April 16th is the beginning of it. And so we plan to run a lot of people through the LifeX facility during that week and, you know, really get it operationalized.
Well, that is really cool. We will have to bring a camera out and check that out when you do it. Coming up in April, LifeX. Rebecca Bagley from the University of Pittsburgh, Dietrich Steffen, CEO of LifeX. Congratulations.
Thank you so much.
Next up, robotics in manufacturing and the critical role that humans will continue to play. Stay with us.